This next video will be going over a case example of shoulder dysfunction. We'll treat unilaterally for the ease of viewing, so we'll work on the right shoulder area, working through the main approach to medical acupuncture. So we'll start with the central nervous system points. Choosing two of them, I chose bladder 10 and bladder 13. So bladder 10 is going to be just distal to the lateral extent of the wing of the atlas. So I'll put it in and then I'll show sort of where it resides. Right about there. And for bladder 13, that guy is going to be lateral and caudal to the spinous process of T3. T3, 4, 5 exist kind of within the border of the scapulas, medial to those dorsal borders. T3 being the most cranial of, or bladder 13 being the most cranial. So what I could do is sort of palpate where my cervico-thoracic junction is, which I would be putting a point in anyways. That's our GB14. So I'll go ahead and do that guy first. I'm using that one as an autonomic nervous system point. And then once doing that palpation, I can kind of estimate, okay, if that's T1, T2, T3, and then we're just going distal to the lateral extent of the spinous process, or sort of midway between dorsal midline and the medial scapular border there. And that's going to be our bladder 13. Moving on to the other ANS point, I actually chose a distal point. I chose large intestine 4. So that's a pretty powerful point as well, and it exists sort of in the web space of where the dew claw would be, and it should be innervating the radial nerve. And so this guy doesn't have a dew claw, but if I kind of imagine where the first and second metacarpal bones are, and kind of halfway up that second metacarpal joint, metacarpal bone, or in the imagined web space, so where my large intestine 4 is going to go right there as our second and distal ANS point. I chose a couple sort of peripheral nerve points as well. So the two I chose was small intestine 11 and large intestine 11. I chose small intestine 11 at the infraspinatus muscle because that can often be one of the sort of trigger strain patterns for shoulder, elbow, kind of forelimb dysfunction there. And so palpating for the spine of the scapula and going into the muscle belly of the infraspinatus, small intestine 11. And then the other one I mentioned was large intestine 11, which exists at the lateral aspect of the elbow crease when flexed. Again, just to be choosing kind of points above and below the shoulder joint there. So you can imagine elbow flexion, the lateral aspect would be about here. Oops. It's getting tricky on Maverick, and I am reusing needles right now, so only because we're practicing in a model. That's my large intestine 11 point. Other thoughts for some PNS or some myofascial points would be treating the supraspinatus, so that's small intestine 12, again on the other side of that scapular spine in the supraspinatus. And with sort of all of these videos, I wouldn't expect to get all of these needles in. I had a hard time choosing, but I know that I would just prioritize the most relevant points, maybe 1 or 2 in terms of the main protocol. We could also do the 2 shoulder points. So kind of palpating for the acromion process. Craniodistal is our large intestine 15. Oh, these are really not happy with the tubes right now, so practicing holding for untubed then. And then the other point would be a triple heater, 14 caudodistal to the acromion process there. And I'm having a hard time without his bones and muscles actually present to be used for landmarks. And so I can tell already that, you know, my 2 points that should be on the acromion, well, the acromion is going to extend to the scapula. My scapular points are way down here, which is maybe more in the region of triceps. So I'm okay with my shoulder points. I think what I would do is adjust my scapular points. So again, for practice, I'll take them out, palpate up from the acromion process, supraspinatus, that's our small intestine 12, infraspinatus, small intestine 11. That's more kind of in line anatomically on this model here. And then for electroacupuncture, again, I don't have a machine yet, but just kind of going through the motions, I was thinking of connecting between my bladder 13, so at that T3 area, and then large intestine 11 to again span the joint. And then in this case, I thought, well, let's go for a 2 to 10 hertz just to provide some, maybe not immediate, but longer term analgesic benefits there. So yeah, that's my example of a shoulder case.